Imagine if you are a doctor and your patient who is terminally ill has no chance of getting better and decides to ask you to relieve him of his suffering. How would you answer his life altering question? By the end of this argument, you will support why allowing patients to recommend euthanasia is justified. This is definitely a topic where a random group of people would be split on, and it would depend on what their views would be. Is euthanasia justified or is it murder? It has to be noted that the patients are the ones who are asking for this because they're the ones who are suffering the most. The problem that most people have with it is whether or not it is the right thing to do, but it is what the patient wants that should matter the most because they are the ones who are going through the pain. Today, I will discuss the reasons why euthanasia should be allowed for patients who recommend it because it should be their right to choose if they want to live or die, and it frees up medical care to treat more patients and have more resources for those who choose to live by allowing patients who want to end their suffering to die on their own terms. I will begin with explaining the value object and the value hierarchies for this debate. The value object is euthanasia, which is a painless killing of patients who suffer from incurable and deadly diseases. Go into the value hierarchy, for the first value, rights. Human beings have the right to live and die how they want to. And for the second value, medical care. This would free valuable medical resources up by allowing the person to make the decision whether they want to live or die. Now that you understand the value object and the hierarchies for this debate, let's shift our attention to the value criteria. Euthanasia should give patients their basic human right to decide whether they want to live or die. And euthanasia should allow medical care to be distributed to others who have chosen the right to live. Now that you have an understanding of our criteria, I will prove my case that allowing patients to recommend euthanasia is justified. First, I will address how euthanasia should be allowed because it does provide patients their basic human right to decide whether to live or die. If these patients choose to end their suffering, then it should be justifiable because in the end, it is their choice whether they want to live or die. The people who suffer from incurable diseases or a debilitating condition with no sign of improvement should have the choice to whether or not continue to live their life. If they are struggling to enjoy life in any way, then they should be given the choice to decide if they want to end all of their pain. An article titled Euthanasia, Right to Life versus Right to Die, published by Suresh Beta Math in December 2012, states an argument for people having the right to choose to die. Quote, euthanasia can be considered as a way to uphold the right to life by honoring the right to die with dignity, end quote. These patients choose to die by having some dignity left and going out on their own terms than having to continue the suffering that they go through. In the article Legalizing Euthanasia or Assisted Suicide, the Illusion of Safeguards and Controls, published by J. Pereira in April of 2011, states that, quote, in all jurisdictions, the request for euthanasia or physician-assisted suicide has to be voluntary, well-considered, informed, and persistent over time. The requesting person must provide explicit written consent and must be competent at the time the request is made, end quote. Whenever the request is made and meets the requirements, the patient should be allowed their choice to die because it is what they want for themselves. Euthanasia is an option that patients should have to end their suffering. Furthermore, it can allow medical care to be distributed to more patients who are trying to survive and to the ones who do not want to suffer anymore. Next, I will address how euthanasia should be allowed to happen because this allows medical care to be distributed to others who have chosen the right to live. Think about all the countless resources that could be given to patients who are trying to survive every day. It could save more lives and make medical professionals' jobs much more easier for them to work with people who choose to keep fighting. If euthanasia is not given to the patients who do not want to be a burden anymore, then giving them what they want will lead to more opportunities to treat the patients who want to live. Again, the possibilities for more lives to be saved are endless, and the people who want their suffering to end get what they want, which is relief. According to Procon.org, in their article, Would Financial Motivations Encourage Insurance Companies and Healthcare Providers to Promote Euthanasia and Physician-Assisted Suicide, last update on August 7th, 2018, it states that, quote, the care provided to the dying or very ill patients, not just their treatment, is expensive and demanding for healthcare professionals. The extra weeks or months of caring for patients who do not opt for assisted suicide or euthanasia will seem all the more futile and costly, end quote. These costs can be astronomical when there is no life expectancy, and the resources could be best used on patients with the opportunity to become well again. An article from the New England Journal of Medicine titled What Are the Potential Cost Savings from Legalizing Physician-Assisted Suicide, published on July 16, 1998, states that computing the likely cost savings from legalizing physician-assisted suicide is based on three factors. Number one, the number of patients who might commit suicide with the assistance of a physician if it is legalized. Number two, the proportion of medical costs that that might be saved by the use of physician-assisted suicide, which is related to the amount of time that a patient's life might be shortened. And number 3, the total cost of medical care for the patients who die, end quote. These factors can be very important for patients who ultimately choose to end their life because it will be financially beneficial to the medical professionals and their patients. After hearing this argument, you should now support why allowing patients to recommend euthanasia is justified. Today, I approve that allowing euthanasia to patients who recommend it is justified because it is their choice to continue to live or die, and medical care would be able to treat more patients because of the allowance of euthanasia for those who decide that they do not want to suffer anymore permits it. For the reasons stated above, I urge you to vote for the advocate's case.